Hello friends, welcome to Easy Nurse, where nursing education made easy. So as your JNM exams, as your exams are coming, we are gonna discuss about adult health nursing in this session. We will talk about adult health nursing 1. So I have mentioned different kind of patterns of question, and according to that, whatever it is important in the subject, I have included in. Okay, so if you are not studying for the book, also if you are not studying through your notes, you can just at least see this video and can obviously get passed into the exam. So further any delay, let's start with our session. So we will first talk about the multiple choice questions, okay, because there where we can get exact full marks. Okay, so there are some multiple choice question. Try to give answer. Okay, if you can, just try to give answers in the comment section. Okay, I'll be calling your names if you can answer. So the first question is, in COPD the high flow oxygen is avoided because. So in COPD cases, why high flow of oxygen is avoided? In the sense, when you are giving ventilation or oxygen marks, why the flow of the oxygen will be decreased? The options are, it is because of the cause of bronchospasm, cause the bronchioles and all, it have already narrowed down. Okay, second one, it suppress the hypoxic respiratory drive, cause the hyperventilation and increase the sputum viscosity. So the correct answer is option B, which is it suppress the hypoxic respiratory drive. The next question is, the earliest sign of hypoxemia is. What is actually hypoxemia? So our options are the earliest signs of hypoxemia. So the options are actually cyanosis, restlessness, brachycardia and hypotension. So as we know, hypoxemia is actually a condition where there will be abnormally low oxygen level in the blood. So here, as per the condition, the actual answer is restlessness. Cyanosis will be on later, when the level of the hypoxemia will be increased. At that time it will appear, but the first sign will be appear is restlessness. Okay, the next question is, for a patient with pneumonia, the most effective position in drainage. Okay, so we know the pneumonia patient lungs and alveoli will be full of mucus and all. Okay, so to clarify the mucus and to drain the mucus, we have to do some procedures. So which is the posture? Okay, which is the posture is there, which is very which is very helpful for the person during the procedure? Supine, side lying, affected side, semi-fowlers and side lining, unaffected side. So the correct answer is option D. This sometimes this question have came, okay, for the fill in the blanks and also remember, side lining on unaffected side is actually the safest position for a patient with pneumonia who is going through the drainage. The next question is, in asthma, wheezing is primarily due to. So in asthma, the patient will be wheezing while taking breath and while inhaling and exhaling. Okay, you can able to hear the sound of wheezing for the patient with asthma. So what is the main reason of that? First of all, it is bronchial edema. Next is airway narrowing and mucus plugging. Third one is alveolar collapse, and fourth one is decreased surfactant. So the main and the correct answer is airway narrowing and mucus plugging of the alveoli and bronchioles. The next question is, the purpose of pursed lip breathing in COPD. Okay, so there is a procedure which helps the patient, to recover or to do the breathing practices to increase the health of the lungs and to increase the capacity of the lungs. So in between that, there is a procedure called pursed lip breathing. So what is the main purpose of this? The main purpose is to Option D, which is delay airway collapse during the expiration. The next question is ST segment elevation on ECG candidate. Why ST segment elevation have to be done? Because of the option B, which is myocardial infarction. So the drug that reduces myocardial oxygen demand, it is option A, nitroglycerin, option B, digoxin, option C, furosemide, and option D, dopamine. So the correct answer is option A, which is nitroglycerin. Next is a patient with left-sided heart failure will most likely present with which signs and symptoms? Option C, pulmonary congestion. The next question is, after a myocardial infarction, the most life-threatening complication in 24 hours can be 1. A heart failure, B. arrhythmia, C. A thromboembolism, and lastly pericarditis. So the correct answer is option B. Before administering digoxin, the nurse what should she do? Okay, before administering digoxin, she must check the apical pulse for a 1 full minute to understand what is the pulse rate. Okay. The next question is, the pain of the duodenal ulcer usually or typically occurs when? Okay, it typically occurs in between the 2 or 3 hours after the meal, relieved by the food. Last is the most serious complication of peptic ulcer. Which is the serious condition? It will be the perforation of the ulcer or the peptic ulcer. The most reliable indicator of return of bowel function after the post-surgery, what is the indicator? The indicator is actually A, which is passage of flatus. Next is, a patient with liver cirrhosis and ascites is placed on D, low salt and moderate protein diet. So patient with liver cirrhosis with moderate, like low protein and low salt diet. Next is, a nurse who suspected gastrointestinal bleeding when the patient passes, what are the symptoms will be there? C, which is black tarry stool. Lastly, the classic trait of diabetes mellitus is actually polyuria, polydipsia, and polyphagia. The next question is, in hypoglycemia, the first nursing action, what is the first nursing action in hypoglycemia? The patient with the low blood sugar is to give the glucose and sugar orally to increase the blood sugar level. In hypothyroidism, the nurse should expect which symptoms or which signs she should expect from the patient? Option is, the correct option is option B, which is weight gain, bradycardia, and cold intolerance. Okay, she will be very fragile to cold. Then a diabetic patient who advised to rotate the insulin injection site for what? Okay, option is B, to prevent the lipidostrophy. Next is, the emergency management of diabetic ketoacidosis include insulin and IV fluids. The next question is, the best position of a patient in shock will be option A, which is supine with legs elevated. To prevent the deep vein thrombosis post-operatively, the nurse should do what she should do? She should encourage early ambulation. The next question is, the early sign of infection will be option C, which is local redness and warmth. Before the chest physiotherapy, the nurse should do administer of bronchodilators. Okay, so these are the multiple choice questions. Okay, now I'm gonna teach you, I'm gonna make you learn whatever the other important topics are, and in between this also some multiple choice question can come. Okay, so try to remember the topics or the main points I am saying. Okay, So first one is intraoperative care. So what is that? Intraoperative care is actually care or nursing care or the when a patient will be hospitalized. Okay, so from that time, during the operation and after the operation also, up to the time he is there in the hospital or the medical agency, okay, whatever the care is given is called as intraoperative care. It includes preoperative, postoperative and interoperative care. So what is preoperative nursing care? The main goal is to prepare the patient physically and psychologically for the surgery, like mentally support, giving advice, okay, try to make him calm before the surgery and all. Okay, so what are the key steps in this? The key step include first one, assessment of the health history, allergies, medication, vital and risk factors. Then investigation, which is the CBC, urine, X-ray, ECG and blood group. And then informed question, like explain the procedure to the patient, obtain signed consent before going to the any kind of surgical procedure. If he or she is adult, then we can take the consent, okay, signed consent. The next point is physical preparation, which is bath, shave, no meal per oral, okay, empty bowel and bladder, remove any kind of ornaments that is present in the patient's body. Then psychological preparation, explain the procedure and relieve the anxiety if the patient have. Lastly, preoperative medication, if we have to give it to the patient if any of the medication have been prescribed by the doctor before the procedure. Here we have to give the prescribed sedatives or antibiotic to the patient. Lastly, transfer it to the OT, ensure the ID, safety and documents. So these are the preoperative care. Now intraoperative, while the patient is the OT, operation theater, what are the things we should maintain? So we have to maintain the safety and assist the surgical team. So this is the main goal of intraoperative nursing care. Next is scrub nurse, who will maintain the sterility, pass the instrument to the doctor and count every item that have been used during the procedure. Then circulating nurse, who will prepare the operation room, then position the patient, monitor the vessel and ensure the asepsis or sanitization of the whole procedure. Then patient safety, where we have to prevent infection, injury and monitor blood loss and anesthesia. Now come to post-operative. So post-operative, why we have to do or why we have to give the nursing care after the post-surgery? The main goal is to prevent the complication and aid recovery. The immediate or PSU, post-operative immediate nursing care, why we have to give? To maintain the ABC, okay, monitor the vitals, consciousness, check the bleeding, pain and keep the patient warm. What is the ongoing care? In between that, the ongoing care will be wound care, where we will observe the dressing and maintain the aseptic technique. Then pain. The pain we have to give, if the patient have pain, we have to give the analgesic and try to give the maximum comfort that is possible. Okay, then position. For the position, we have to prevent the aspiration and the ulcers. Okay, so pressure ulcers can happen or can occur for the patient who is continuously sitting or sleeping in a position for a longer period of time after the surgery. So we have to prevent the aspiration and ulcer. Then nutrition, more fluids and soft diets for the patient. Elimination, like monitor the output and input of the patient. Ambulation, we have to prevent the DVT, deep vein thrombosis and pneumonia. Okay, lastly education, we have to teach the wound care properly after before we release the patient from the hospital. Medication, regarding the medication, what time to take, how much dose you have to take and all, and activity limits up to a particular date. So these are the post-operative nursing care. Next, move on to the common signs and symptoms of nursing management. So for fever, or also called as pyrexia, how we can manage the patient, okay, or what the things we should do. So fever is actually raise in body temperature. Our normal body temperature is around 37.2 105 degree Celsius or 96.4 degree Fahrenheit. Okay, if it is more than that, okay, so we will be considered as fever. So it can be due to any kind of infection, inflammation, or any kind of trauma or mental stress or physical stress. So what is the nursing management? As a nurse, what should we do? So we should maintain the assess, which is monitor the vital signs, find the cause of the fever, and note chills or sweating whenever it is there. Okay, next we have to control the temperature, cool the room. Okay, tepid sponge bath if the temperature is more than 1 or 2 degree Fahrenheit, and avoid any kind of covering. Then hydration, we have to encourage the fluid intake like ORS and IV fluids. The medication, we can give the antibiotics, or any kind of antibiotics as per the doctor's order. Comfort like rest, hygiene, clean linen and all. We also have to monitor and watch the dehydration and any kind of convulsion or giddiness. Lastly, we have to educate or teach the cause, prevention, and how to maintain the hydration to the patient and their family. So this is the nursing management of fever. The next one is dehydration. So what is dehydration? Dehydration is excessive loss of water from the body or fluid and electrolyte imbalance in the body. So what are the signs we can see for the dehydration? Dry mouth, sunken eyes, poor turgor, thirst, low urine and low blood pressure. So as a nurse, how we can maintain it? First of all, we have to assess the input and output, vital signs. We have to check the skin and electrolyte that present in the blood. Okay, we have to check the level of them. Next is fluids. We have to provide fluids like oral supplements and all, like ORS, oral rehydration therapy, mild, or in the cases of severe cases we can provide IV fluids, intravenous fluids as well, saline and all, RX and all. Okay, now after that we have to monitor the urine output, blood pressure and any kind of turgor in the skin. Then comfort, which is oral care, avoid caffeine and alcohol because that may increase the dehydration again. Then diet, which is soft food, soup, okay, electrolyte drinks. And lastly, education. We have to give the education to prevent during the fever, diarrhea and hot water. Okay, so these are the common signs and symptoms and nursing management of a patient with dehydration. The next question is COPD or chronic obstructive pulmonary disease. The chronic obstructive pulmonary disease is actually chronic progressive airflow limitation due to bronchitis or emphysema, which is inflammation and infection of the bronchioles. How it can happen? It can happen because of the various type of bacteria, allergies, okay, or continuous smoking and all because of nicotine. Okay, so there will be infection and inflammation, mucus release, and there will be pus formations. Okay, so this can clog the airway and the airflow will be limited. So this is called as chronic obstructive pulmonary disease. What are the main cause? The main cause includes smoking, pollution, infection, genetics and occupational dust, especially the persons who work in coal mine, okay, or they work with the cotton or fiber, or they work with the asbestos. They they usually suffer through this kind of disease. What are the features or signs and symptoms we can see for the patient with COPD? We can see the chronic cough with sputum, sometimes with blood as well if the case is very severe. Then dyspnea and wheezes, barrel chest. Okay, barrel chest in this sense, the chest will be like kind of pigeon chest also, you can say. The chest will be kind of barrel shape. Okay, usually the chest will be like this, right? But here what will happen? Because of the excessive inflammation and all, the chest will become like the barrel shape. Okay, Along with that, there will be cyanosis and fatigue. So how as a nurse we can manage this kind of condition? We can manage it through the assessment, which is actually respiratory rate assessment, efforts, SpO2, which is concentration of oxygen in the blood, sputum test, and arterial blood gas test. Next, oxygen. We have to maintain a very low flow of oxygen in the oxygen mask, 1 to 2 liter per minute to avoid, and we have to avoid the high oxygen. Okay, next is airway clearance, which is deep breathing, coughing, chest physiotherapy, and fluids. Next, we have to provide medications such as bronchodilators, steroids, antibiotic, and mucolytics. Sometimes this question can come that which types of medication we can provide to the patient with COPD. Okay, chronic obstructive pulmonary disease. So we can provide bronchodilators, steroids, antibiotic, and mucolytics. The next one is nutrition, which is where we have to provide small, high protein, high calorie meals, and we have to give the rest before and after of any kind of procedure. Then activity, where we have to give the gradual exercise and adequate rest. Next is education. We have to educate patient on why we should why he or she should stop smoking, avoid any kind of irritants that can increase the level of the infection and all, and pulse, sleep, breathing, exercise, vaccination, and follow-up procedure. So this is about the COPD. The next question is gastrointestinal disorder or peptic ulcer disease. How as a nurse we can manage it? So first, to know what is the main thing. So it is the erosion of stomach or duodenal mucosa due to acid or pepsin. Okay, especially if the acid amount, the gastric juice amount is continuously increasing in the stomach. Okay, and there is no food or because of something, it can be cause of anything. Okay, but in the most cases there will be, if the stomach is empty, continuously deposit of HCl in a place without any food can cause the peptic ulcer. Okay, so the main cause other than that is H. pylori infection, non-steroidal anti-inflammatory drugs, stress, smoking, alcohol, and geriatrics. Okay, so what are the features? The features include, or the signs and symptoms include epigastric pain, nausea, vomiting, heartburn, weight loss, bleeding such as hemostasis or melena. Okay, so as a nurse, how we will manage this? We have to assess the pain pattern, vital signs, and bleeding of the patient. For the diet, we can give the small bland meals, avoid any kind of spicy food, caffeine, alcohol, smoking, and no late meals. Okay, every meal should have to be like breakfast, lunch, dinner, everything have to be taken on proper time. Neck comfort, we have to give the rest and stress reduction for the patient. Monitor, we have to monitor, watch for any kind of bleeding, root, black stools, or severe pain. Education, which is complete treatment to avoid NSAID and manage stress, or giving the regular meals to the patient. Now for the patient with peptic ulcer, what are the medication we can give? We can give antacid, H2 blockers or ranitidine, PPIs, which is omeprazole, antibiotics for H. pylori virus, and sucralfate, which is mucosal protection. Okay, so these are the things as a nurse we can do. The next condition is cardiovascular system myocardial infarction, also called as heart attack. So death of heart muscle due to blockage of coronary artery is called as myocardial infarction. The main cause is atherosclerosis, thrombosis, spasm, hypertension, smoking, diabetes, and stress. Okay, how it can happen? Because of the causative factors. Okay, due to that it will lead to plaque rupture. Okay, what will happen? Continuous deposition of fat or bulging of the arteries. What will happen? It will be narrowed, and this plaque sometimes can be rupture, and because of the rupture what will happen? The bloods will start disrupting. Okay, they will break down. and for that the thrombus will happen, and because of the thrombus the blood flow will be decreased. Okay, it will leads to ischemia, which will where the blood flow will not be properly, and because of that oxygen will not reach to the perfect places, which will leads to necrosis, which is cell death, and due to that the cardiac output will be again very low, and it will lead to arrhythmias. Okay, so this is the pathophysiology. Now what are the signs and symptoms? It includes severe chest pain regarding the arm, jaw and back, sweating, anxiety, dyspnea and nausea. Then hypotension, tachycardia or brachycardia, cold and clammy skin, ECG where we can see the ST and T wave inversion and ST elevation. Okay, so the T will be in down, okay, it will become like this, and ST will be more elevated. Okay, in ECG if you can see. Okay, so next is the cardiac enzyme like troponin and CKMB will be increased again. Okay, so these are the main common signs and symptoms. Now as a nurse, how we can manage this? We have to do the immediate care, which is also called as MONA. It can come for 2 marks. It is very important. Okay, so it can come for 2 marks. So the morphine, we aim for morphine for the pain and anxiety, O for oxygen, which is 2 to 4 liter per minute, N for nitrates or vasodilator, which will work as a vasodilator, then A for aspirin, which is work as a antiplatelet. Okay, so this is the immediate care or called as MONA. Assessment, then we have to do the assessment like monitor ECG, vitals, urine output and consciousness. We have to check. As a medication we can give thrombolytics, beta blockers, ACE inhibitors, antiplatelets, anticoagulants and stool softener. The rest and comfort we can give to the patient is bed rest, semi-flawless position, calm environment. Then oxygenation and circulation, we have to give the oxygen administration and avoid any kind of strain or exertion. For the nutrition, very low fat, low salt, small meals, and we have to suggest the patient to avoid caffeine and alcoholism. Then health education, we can suggest the patient to work gradually and be gradually active, medication adherence, stop smoking, control blood pressure and diabetes, manage the stress, recognize the warning signs. Okay, so these are the nursing management we can give to the patient with myocardial infarction. Now come to blood disorders. So we will talk about anemia. So what is anemia? Anemia is a condition where is a decrease in total red blood cell count of hemoglobin concentration leading to reduced oxygen supply or carrying capacity of blood. Okay, so there are different types. So I have shortlisted 6 types. Okay, these are the main types. First one is iron deficiency anemia, which is due to insufficient iron intake in the blood or blood loss. Okay, then megaloblastic anemia, which is caused by the deficiency of vitamin B12 or folic acid. Okay, especially megaloblastic anemia you can see in the patient and the persons who are pregnant and all. Okay, and they are not taking supplements, you can see this megaloblastic anemia. Next is hemolytic anemia due to premature destruction of RBC. So we know the main RBC, the mature RBC, like the RBCs will be lived from 80 to 120 days. Okay, this is the lifespan. But in some patient what will happen because of lymphosarcoma or like blood cancer, in that cases what will happen, before the maturation of the red blood cell it will be damaged. Okay, it will be damaged or it will be destructed. That is hemolytic anemia. Next is aplastic anemia, which is due to bone marrow failure. So we know our red blood cell, our blood, everything has been produced by our bone marrow. So if it is the bone marrow will be damaged and all, then in that case the cells will not be produced. So it is due to the bone marrow failure. Next is sickle cell anemia, which is a genetic disorder which causing the abnormal hemoglobins. Okay, there is pernicious anemia. Okay, pernicious anemia, which is actually due to lack of instinct factor, which is affecting vitamin B12 absorption in the blood. Okay, so these are the types. Now what are the main causes? The main causes are nutritional deficiency such as iron, folate, vitamin B12, chronic blood loss such as menorrhagia, peptic ulcer, hemorrhoids, chronic disease such as renal failure and infections, bone marrow suppression in the cases of chemotherapy and radiation, genetic disorders such as thalassemia and sickle cell. Now as a nurse, how we will manage it? We will manage it through the assessment to observe the pallor, fatigue, okay, tachycardia, shortness of breath, and monitor the hemoglobin and the hematocrit levels of the blood. Next is dietary management. In dietary management, we have to provide the iron-rich food such as liver, okay, then green leafy vegetables, egg and meat. Then we have to encourage the vitamin C intake to enhance the iron absorption. Then for metabolic anemia, we have to give the B12 and folic acid supplement to the patient. For the medication, we can administer iron supplements, okay, which is ferrous sulfate as prescribed by the doctor. Other than that, we can use erythropoietin for chronic renal anemia. Then preventive care. For preventive care, we can treat the underlying causes such as blood bleeding and infection, educate on the proper nutrition and follow-up. Then lastly, we can go for the rest and comfort for the patient, where we have to provide adequate rest and reduce the oxygen demand. We have to monitor the vital signs and provide the oxygen therapy if it is needed. Okay, let's move on to the next system, which is endocrine system. Now endocrine system, we know there are different, like thyroid glands are there, okay, pancreas is there. So there is a disorder called as diabetes mellitus. Okay, so now what is diabetes mellitus, or you can say in non-medical term you can say blood sugar. Okay, so diabetes mellitus is a metabolic disorder characterized by chronic hyperglycemia resulting in defects in insulin secretion and insulin action, or both. So what will happen when the blood sugar level, the carbohydrate level will not be, continuously the glucose. Okay, carbohydrate in the sense the smallest form will be glucose, right? So the glucose will be not absorbed in blood properly, or the metabolic reaction will not happen. It will be not in use, right? So it will stay in the blood, and continuously the amount of the glucose will be increased in the blood. It can be due to insulin defects and all. It can be due to less insulin secretion or insulin action, or sometimes it can be both. Okay, so that is called as diabetes mellitus. So there are two types of diabetes mellitus main. Okay, so type 1 and type 2. Other than that, we also have one which is called as gestational diabetes mellitus, which only happen during the pregnancy. So type 1 diabetes mellitus is insulin dependent mellitus. Okay, like depend on the insulin secretion and all, the work of the insulin. Type 1 diabetes mellitus happen. It is because to autoimmune destruction of the beta cells. So we know in the islets of Langerhans, okay, in the pancreas, islets of Langerhans cells, the beta cells will be producing the insulin. So if any kind of autoimmune disorder happen, the beta cells will be dying and insulin production will be reduced. Type 2 diabetes mellitus is actually insulin resist or decreased secretion of the insulin. Okay. So the main causes of diabetes mellitus include genetic predisposition, obesity and sedentary lifestyle, pancreatic disorder, hormonal imbalance such as Cushing syndrome, certain drugs, steroids and thiazides. Okay, so what are the clinical manifestation? What are the symptoms we will see in the person with the diabetes mellitus? We will see the classic symptoms, which is polyuria, excessive amount of increase in urine, okay, polydipsia, polyphagia, weight loss and fatigue. Other than that, there will be delayed wound healing and recurrent infection, blood vision in severe cases and ketoacidosis, or it can go even to, patient can go even to coma. So as a nurse, what we can do for the assessment, we can assess the monitor the blood glucose level regularly. We have to observe for any kind of signs of hypo or hyperglycemia. Okay, suddenly the sugar level can be increased or decreased, so that also we have to monitor. For the dietary management, the balanced diet with the controlled carbohydrates or less carbohydrates. Then encourage the fiber rich or low fat food diets, avoid sugary foods and any kind of alcohol. Then for the medication, we can go for insulin therapy for type 1 diabetes mellitus and oral hypoglycemic for type 2 diabetes mellitus, which is metformin and glibenclamide. Okay, next is for the for exercise, we can suggest the patient for the regular physical activity to improve the glucose utilization, because it can transform into, because of the glycolysis, it can provide the ATP and energy for the body. Next is foot and skin care, which will inspect the feet for daily for cuts or ulcer and keep the feet clean and dry to avoid tight footwear. Okay. Next is health education. As a health education, what we can provide, we can teach the self monitoring of blood glucose level with the glucometer and all. Okay, and recognize and manage the hypoglycemia and give the glucose or sweet. Okay, so this is the nursing management. The next is burn. So as we know, what is burn? A burn is an injury to the skin, underlying tissue, and the cause is because of heat, chemicals, electricity or the radiation. So we have different types. So there are three main types, which is first degree, second degree and third degree. And the first degree will be involves the epidermis, the exact surface layer only. There will be redness and mild pain. Okay, and it will heals without any scarring of the skin. Then second degree burning. Second degree burning is also called as partial thickness burning, which involves the epidermis and the part of dermis layer also. There will be present of blister, swelling and severe pain. In the third degree burn or full thickness burn, it involves all skin layers and underlying tissue. It will the white appearance and painless, because there will be all nerves will be completely damaged. Okay. So what are the cause? The cause of the burns can be thermal, which is flames or hot liquids, chemicals like acid, alkalines, electrical or current exposure, radiation such as sunburns and x-rays. Okay, so these are the types of burn. Now as a nurse, how we can manage the situation? We can manage it through emergency care, such as stop the burning process, remove the clothing jewelry near the area, do not apply ice or ointment initially, because if it is a severe second degree or third degree burn, patient can go in the hypovolemic shock. Okay, and patient can die. Okay, so maintain the airway, breathing and circulation, the ABC we have to maintain. Then fluid resuscitation we can do using the Parkland method from IV fluids in Ringer's lactate. We have to monitor the urine output and it should be less or equal to 30 ml per hour. The pain management, we can administer analgesics and sedatives as prescribed. The wound care, we have to maintain the aseptic techniques, apply the topical antibiotics like as silver sulfadiazine. Okay, sulfadiazine, and we have to perform the dressing change very carefully. Okay, and here we have to maintain very strict asepsis technique. For the nutrition, we have to give high protein, high calorie diet to promote the healing process of the person. Prevention and complication, prevent the infection and contractures. We have to encourage for gentle range of motion exercise. Psychological support, we can provide reassurance, counseling and emotional care for the patient. Okay. The next is musculoskeletal system. So in musculoskeletal system, we're gonna read about fracture. So what is fracture? Fracture is a break in the continuity of a bone due to any kind of trauma. Now there are types. So simple one is bone which is broken intact with the skin. Okay, you can see here. Then compound. Okay, so compound is bone break through the skin. Okay, you can see the bone will be break through the skin. If this is the leg, the bone will be break through the skin. Okay, and comminuted, which is here, which is the bone will be splitted into fragments. Then green stick, which will be incomplete fracture, like common in children. Okay, incomplete fracture, the fracture will be not be complete. Okay, here will very little crack will be there. Then pathological, like occurs due to bone disease such as cancer or osteoporosis. And lastly, impacted. Now what is impacted? Impacted is one fragment driven into another. Okay, so that is called as impacted fracture. So these are the types of fracture. Now we'll see what are the complication can come because of the fracture. Okay, so first one is hemorrhage and shock. Infection, especially in open fractures, okay, or called as oblique or displaced fracture. Then fat embolism, non-union or malunion, compartment syndrome, joint stiffness and deformity. As a nurse, what are the cares we can give for the emergency management? We have to immobilize the affected limb using splint. We have to control the bleeding and cover the wounds with the sterile dressing. Do not attempt any realign of the bone without the medical advisor. Okay, check the circulation distal to injury. These are the emergency management. Other than that, post-operative or the casting care, what are the things we should do? We should keep the cast dry and clean. We have to elevate the limb to reduce the swelling, assess the color, movement and sensation. We have to encourage the isometric exercise. For the pain management, we can administer prescribed analgesic, provide the comfort and proper positioning of the person. For the nutrition, we have to encourage calcium, protein and vitamin D rich diet. Okay, next is prevent complication. How we can prevent complication of the fracture? We can prevent it through the infection in open fractures, prevent the pressure sores and DVTs, okay, deep vein thrombosis in immobilized patient. For the rehabilitation, we can assist in ambulation and physiotherapy if that kind of severe fracture have happened. We have to teach the cast care and home exercise. The next one is pulmonary tuberculosis. This is also a very important question. It can come under the respiratory system. Okay, so what is that? The pulmonary tuberculosis is actually because of the Mycobacterium tuberculosis. There will be infection and inflammation in the lungs. So Mycobacterium tuberculosis is an acid-fast bacillus bacteria which is transmitted via the droplet infection. Okay, so what is the clinical features? The clinical features include persistent cough more than 3 weeks with sputum, hemoptysis, which is blood in sputum, fever especially in the evening, night sweats and weight loss, then fatigue and chest pain. For the nursing management, what we can do, we can assess the we can give the patient isolation, and for them we have to assess for cough, weight loss, fever, sputum color. Isolate the patient in well ventilated rooms such as airborne precaution to avoid the airborne spreading and all. And lastly we have to use the N95 mask for the stop spreading the or to avoid the spreading of infection. Other than that, for the medication therapy or DOTS therapy, we have to provide in intensive phase 2 months HRZD, which is isoniazid, rifampicin, pyridazamide and ethambutol. And for the continuation phase for 4 months, we have to give HR, which is isoniazid and rifampicin. We have to ensure the adherence of the treatment directly observed therapy, okay, or DOT therapy. And this is also a 2 marks question. This is very important. Okay, 2 marks question, 1 marks question also it can come. Then nutrition for the patient with pulmonary pulmonary tuberculosis. Okay, we have to provide the high protein, high calorie diet. We have to provide iron and vitamin supplements. So what are the health education we can give to the patient? We can cover the mouth while we can suggest the patient to cover the mouth while coughing and sneezing and dispose of sputum safely. Okay, continue the drugs even after the symptoms are relieved. Educate about the BCG vaccination for prevention. For the psychological support, we can provide the emotional support and counseling. The next is hypertension. What is hypertension? It is the increased blood pressure. Okay, The hypertension is a persistent elevation of systolic blood pressure, okay, which is 140 mm of Hg, or diastolic blood pressure, which is 90 mm of Ag, okay, which is the normal one. If it is more than that, then it, like near to this or more than that, it will be considered as hypertension. Okay, so the main causes are idiopathic, which is unknown cause related to hereditary, obesity, stress and smoking. Secondary will be renal disease such as glomerulonephritis, especially in the kidney patient, okay, kidney failure patient, you can see this. Then endocrine disorders such as Cushing syndrome or hyperthyroidism. Medications such as oral contraceptive pills also can increase the blood pressure. Then pregnancy induced hypertension. Okay, so what are the complications or what are the signs and symptoms we can see? We can see for the patient with continuous hypertension, we can see stroke or transient ischemic attack, myocardial infarction, heart failure, renal failure, retinopathy, vision loss and aneurysm. Okay, then nursing management. So what are the nursing management are there for the patient with hypertension? We have to measure the BP regularly and assess the headache, dizziness, blood vision and chest pain. For the medication, we have to administer the antihypertensive or ACE inhibitors, beta blockers and diuretics. Also we have to monitor the side effects and compliance of the drugs. Next, dietary modification, we have to give the patient or advise the patient to take low salt, low fat diet, increase the fruit, vegetables and fibers, avoid alcohol and caffeine. For the lifestyle changes, we can suggest the patient for the weight reduction, regular exercise, stress management and smoking cessation. The next condition is pressure ulcer. So what is that? So a pressure ulcer is localized injury of the skin or underlying tissue caused by prolonged pressure, okay, over on or by bony prominence, okay, especially in the hip area, in the toe areas, in the knee areas, on the back of the elbow, okay, you can see the pressure ulcers, okay. This is also a very important question for 2 marks and 5 marks as well, okay. So what are the causes? The causes are immobility and prolonged bed rest, friction and shear, moisture from incontinence, malnutrition or poor circulation of blood in the particular area, advanced age and chronic illness are the main reason of pressure ulcer. How we can prevent it? We can prevent it through the frequent repositioning in every 2 hours, use pressure relieving devices such as foam mattress and cushions, keep the skin clean and dry, maintain the good nutrition and hydration of the patient, avoid the friction and shear during the transfer. So what are the nursing care we can do for the patient? We have to assess the skin daily for redness, warmth and breakdown. For the wound care, we can clean with saline, use the appropriate dressing. Pressure relief, we can repositioning patient and use the supportive service. For the nutrition, we can provide high protein, high calorie diet to promote the healing. For the pain management, we have to administer the analgesic as per needed and prescribed. Education, we have to teach the patient and the family about the repositioning and the skin care. The next is principles of surgical asepsis. Why it is important? The surgical asepsis actually avoid exposing the client to the microorganism during the procedures. First of all, we have to maintain the sterile objects. Only sterile items may touch other sterile items. Like as example, I have cleaned bath, I have done surgical hand washing and all, I wore the sterile gloves. Now after wearing the sterile gloves, I can only touch one sterile item and I am doing procedure. Now I can't go back and again touch one sterile item. One person should be there who will be completely sterile, and he or she will be just dropping the sterile item in my hand, so there will be no contamination. Next is sterile field. A sterile field must be maintained and avoid the contamination. If one instrument is unintentionally or mistakenly have been dropped in the floor, it should not be touched, okay. Then hand hygiene, we have to maintain proper hand washing and gloving before the contact. We have to maintain the exposure, like limit movement and talking over the sterile area, because from our mouth droplets can come and contaminate the area. Then minimal exposure, limit movement, talking already told. Then proper going, okay, like gowning, like sterile attire in operating room. Avoid cross contamination, like sterile and non-sterile items must be kept separate. Then sterile packaging, where we can check the expiration and integrity of sterile packs before use. And lastly, immediate action. If the contamination occurs, we have to correct it immediately. Okay, so these are the principles of surgical asepsis. Next is oxygen therapy and nurse's responsibility. If a patient, for a patient we are giving the oxygen therapy, what are the things we have to maintain? We have to administer oxygen therapy is actually administration of oxygen to prevent or correct the hypoxemia. So nurse's responsibility includes assessment, which include monitor the oxygen saturation, respiratory rate, signs of hypoxia. For the delivery, we have to ensure the proper device such as nasal cannula, mask and flow rate. For the safety, we have to avoid open flame, secure tubbing and no smoking. For skincare, we have to prevent pressure sores from the marks or tubing. For the documentation, we have to record oxygen flow, patient response and observation. Education, we can teach the patient for the purpose and safety of oxygen therapy. Next, as type of management, types and management of shock. So there are 4 types of shock, which is hypovolemic due to blood and fluid loss, cardiogenic due to heart failure or myocardial infarction. Next is distributive, which is septic, anaphylactic or neurogenic shock due to vasodilation. And lastly, obstructive due to obstructed blood flow such as pulmonary embolism. So what are the nursing management? For the shock and all, we have to monitor the vital signs, urine output and mental status of the patient. We have to maintain the airway and oxygenation. We have to initiate the IV fluids, blood products as prescribed. We have to administer the medications such as vasopressor and antibiotics. For the positioning of the patient, we can give supine, legs elevated, and for the hypovolemic shock. For this kind of patient, we have to monitor for complications and document intervention as much as possible. The next is blood transfusion and reaction of nursing responsibilities. So there are different types of reaction. Acute hemolytic can provide fever, chills, hypotension and hemoglobinuria. Febrile non-hemolytic, which can provide be the reason of fever, chills and no hemolysis. Allergic will provide the symptoms of or will show the symptoms of rash, itching, hives. Anaphylactic will be severe hypotension, dyspnea and shock. Circulatory overload, which will show the symptoms of dyspnea, hypertension and pulmonary edema. Okay, now come to nursing responsibility. We have to verify the patient identity, blood group and cross match the blood. Then we have to monitor the vitals before, during and after the transfusion of the blood. We have to observe for early signs of reaction. Stop transfusing or notify physician if any kind of reaction occur. We have to maintain the IV access and manage the complication. And lastly, document all the observation and interventions we have done. Now come to nursing management of patient with diarrhea. So what are the things it will come? First, for the assessment, we can provide the frequent consistency, signs of dehydration and electrolyte imbalance. We have to assess and record. For the hydration, we can encourage oral fluids, ORS, oral rehydration therapy and IV fluids if the condition is severe. For the medication, we have to provide or administer the antidiarrheal or antibiotic as prescribed by the doctor. For the diet, bland, low, reduced diet, avoid spicy or fatty or oily foods. For the hygiene, we have to maintain the perineal skin care to prevent irritation. For monitoring, we have to observe for complications such as hypovolemic shock and electrolyte imbalance. For the education, we can teach the patient hand hygiene and food safety. Next, come to pathophysiology and nursing care of asthma. So what is asthma? It is actually a chronic inflammatory disease airway which is characterized by bronchial hyperresponsiveness and reversible airflow obstruction. Okay. So if in tuberculosis also it can be reversible, but asthma is non-reversible. So pathophysiology include allergen or irritant which will trigger the inflammation which will leads to bronchoconstriction and mucus production in the alveoli, which will again leads to airway or edema, which will and because of that the airflow will be reduced. Then hypoxia may develop severe attacks. Okay, so this is the actual pathophysiology of asthma. This question is also very important. Okay, so what are the nursing care we have to provide? We have to assess the respiratory rate, breath sound and oxygen saturation. We have to administer bronchodilators and corticosteroids as prescribed, provide the oxygen therapy if it is hypoxic, teach the use of inhalers and peak flow monitoring. We have to educate the patient to avoid triggers, and lastly monitor for the complications such as status asthmaticus. The next is nursing management of patient with renal failure. This is a 10 marks question. So renal failure, you know, kidney failure, the kidney will not able to filter our urine. Okay, so we are, as a nurse, we have to monitor the urine output, daily weight, blood pressure, lab values such as BUN, creatinine and electrolytes. So what are the cares we can provide to the patient? We have to maintain the fluid and electrolyte balance, administer prescribed medication, provide the renal diet, prepare patient for dialysis if it is required, monitor for complications such as infections, anemia, fluid overload and all, and educate the patient and family on disease management and diet. The next question is fluid and electrolyte imbalance types and management. So there are two types of fluid imbalance. Okay, fluid imbalance, which is dehydration or called as hypovolemia, and overhydration, which is called as hypervolemia. Then electrolyte imbalance such as sodium, potassium, calcium, magnesium and phosphate. Okay, so how we can manage this? We can manage it through the assess of intake, output, weight, vital signs and lab values of the patient. And along with that we have to administer the IV fluids or electrolyte as prescribed by the doctor. Then monitor for signs imbalance such as edema, arrhythmia and confusion. We have to educate the patient on diet and hydration. We have to provide the ongoing monitoring and documentation. Next, what is the role of a nurse in caring for terminally ill patients? So we have, as for the assessment, we have to do the pain assessment, symptoms, emotional and spiritual needs. We have to give the care for pain management, comfort measure, hygiene and nutrition. We have to give psychological support. We have to do the open communication, end of life care, and provide the guide to the family and home care, medications as symptoms management. Next is ethical and legal issues of the medical surgical nursing practice. What are the ethical principles? Autonomy, beneficence, non-maleficence, justice and confidentiality. For informed consent, they should ensure patient understand the procedure and risk before signing and before doing the procedure. Then patient rights, respect the dignity, privacy and the right to refuse treatment for the patient. Then legal responsibilities, which include adherence to hospital policies, proper documentation, reporting of errors. Then accountability, which include nurses' responsibilities for safe, competent care and advocacy to protect the patient-based interest. Now we will see some of the short question. I have given the answer. You can just check the answer. Okay. So first one is mentioned two early signs of hypovolemic shock, tachycardia, hypotension. Name the two common complications of immobility, which is pressure ulcer and deep vein thrombosis. Give two nursing intervention of pulmonary edema, which is administer oxygen therapy as prescribed and position patient upright, high Fowler's position. List three nursing responsibility during oxygen therapy, which is monitor oxygen saturation, ensure proper flow rate and delivery device, observe the signs of the toxicity. Next question is mention two causes of fluid electrolyte imbalance. Name of the two effects of hypothyroidism, cardiovascular system, tachycardia, increased systolic blood pressure. Then give two nursing priorities to accurate kidney injury, which is monitor urine output and maintain the electrolyte balance. List two signs of left-sided heart failure, dyspnea, pulmonary edema. Mention two important steps of preventing surgical site infection, which is to maintain strict aseptic techniques and proper preoperative skin preparation. Then name two contemporary mechanism of respiratory acidosis, include increased renal erection and hydrogen ions, retention of bicarbonate or HCO3, ions by kidneys. Then give to nursing consideration for anticoagulant therapy. The monitor for the sign of bleeding and check for coagulation profile. Lastly, mention too early nursing intervention in burn patients, such as assess the airway and breathing immediately and start IV fluid resuscitation as per the Parkland formula. The next question is list 2 nutritional measures to promote the wound healing, which is high protein diet and adequate intake of vitamin A, C and zinc. Name 2 physiological changes in chronic hypoxia include polycythemia, clubbing of fingers. Then give 2 effects of aging drug metabolism, which is slower hepatic metabolism and decreased renal exertion leading to drug accumulation. Lastly, mention 2 nursing intervention to prevent the pressures reposition of patient every 2 hours and use the pressure relieving devices such as cushion and mattress. List 2 factors of affecting oxygen delivery in critically ill patient will be hemoglobin concentration and cardiac output. And the last question is give 2 signs of right-sided heart failure will be peripheral edema and jugular vein detention. Okay, so that's it for today, guys. I have discussed most all of the important question. If you are not able to join the live class, it is recorded in our YouTube channel Easy Nurse, or if you want to purchase our any kind of course, any kind of SEM, which include all the notes, video lectures, and we are having a chatbot also, which will provide in the which is called as community forum, where you can ask the questions and we will definitely provide you the answer. Okay, so thank you for today's session, guys. See you in the next session. Till then, keep learning and keep exploring with Easy Nurse. Thank you.